A 50-year-old male present to the physician complaining of mild pain in his foot. The patient has no other abnormalities. During the examination, the doctor asks the patient to stretch his lower body well. The doctor insists the patient to invert and evert his foot. Apart from stretching the hamstrings and calf muscle, the patient feels pain while everting and inverting his foot. The patient is otherwise vitally stable and other physical examinations are unremarkable. The patient has an abnormality in which of the following joints: subtalar joint, tibiotalar joint, inferior tibiofibular joint, tarsometatarsal joint. We have to find one of the joint from this. First we should know about inversion and eversion of the foot. What is inversion? Inversion, it is nothing but a inversion is nothing but a range of motion. It will be more in inversion. Why? Because 30 degree range of motion in case of inversion is 30 degree. That is why range of motion is more in inversion. Inversion, it consists of adduction of forefoot. Forefoot will be adducted and forefoot will be laterally rotated, and ankle will be plantar flexed. Ankle will be plantar flexed and forefoot will be adducted and forefoot will be laterally rotated. So these three movements are involved in inversion, and we if such movements are involved, we say that was inversion. Okay, so this is when foot is off the ground. Suppose if foot is on the ground, range of motion it will be less in case of both inversion and eversion. And when foot is on the ground, inversion, it consists only of the lateral rotation of the forefoot. Only lateral rotation of the forefoot. There will be no adduction of forefoot. There will be no plantar flexion of the forefoot. Only the lateral rotation of the forefoot. Adduction of forefoot and plantar flexion of the ankle. It is involved in the when the foot is off the ground. Okay, when we are not placing foot on the ground, those two movements will be added: adduction of forefoot and plantar flexion of the ankle. But when the foot is on the ground, it consists only of the lateral rotation of the forefoot, and heads of the medial two metatarsals are raised when the foot is on the ground in case of inversion. In case of eversion, range of motion it will be more the same thing. Eversion, it is consist of abduction of the forefoot. The exact opposite of the adduction is nothing but abduction, which is nothing but moving away from the median, away from the median plane. Adduction is nothing but moving towards the median plane. So now rotation of the forefoot, pronation. So we when there is a pronation, when there is medial rotation of forefoot, there we had lateral rotation of the forefoot in case of inversion. Suppose if there is medial rotation of the forefoot, we say that movement is eversion, and which is combined by abduction of forefoot and dorsiflexion of the ankle. The exact exact opposite actions of what happened in inversion is eversion. Okay, abduction of the forefoot, medial rotation of the forefoot, dorsiflexion of the ankle. Range of motion, it will be less in case of eversion. Eversion consists only medial rotation of the forefoot. So when the foot is on the ground, only medial rotation of forefoot happens in case of eversion. Suppose if it is on the ground, and if you have to invert, there will be only lateral rotation involved. Okay, head of the lateral three metatarsals are raised in case of eversion, but head of the medial two metatarsals are raised in case of the inversion. Abduction, adduction of forefoot, lateral rotation of the forefoot, plantar flexion of the ankle, there abduction of forefoot, medial rotation of the forefoot, and dorsiflexion of the ankle. Here only lateral rotation, here only medial rotation. Medial two metatarsals, lateral three metatarsals are raised.